Good evening and a warm welcome to all of you to IHW Council's special web series on women's health, Break the Silence, Feminine Health Matters. I'm Anisha Nair Dhawan, your host for the evening. In association with Alma FemiLift, today we want to talk about all the myths surrounding vaginal health. Have you been schooled that your vagina is inherently dirty and you need feminine hygiene products like perfume douches, washes, and wipes to scrub the natural odor away? Or has the girls' washroom gossip told you that eating oranges can stop the funny smell from down below? Do you think vaginal discharge is dirty and perhaps a sign of a disease and you can't do without your panty liners all month long? Are you hesitant to go to your gynecologist because of bacterial vaginosis, which you were told is a sexually transmitted disease? Today, we're going to bust all these myths and more. I have with me a knowledgeable and experienced panel of experts who will give you the right information about vaginal health. In case you have any questions when you're hearing them, do type them into the comment section of this live comment, and do like our page and share it with your friends if you like it and if you think that will help them. We'd like more people to come out and talk about this on the social media platform. You can go ahead and ask your questions, and we have doctors joining us to help answer all your queries. Now, please welcome Dr. Samundi Sankari. She's gynecologist and obstetrician, Director, Shrishti Hospital, Chief Consultant, Shrishti Fertility Center, and Consultant at Amara Med Aesthetics, Chennai. Please also welcome Dr. Apurva Palam Reddy. She's a gynecologist and obstetrician, infertility specialist, and consultant at Phoenix Specialty Clinic, Bengaluru. We also have with us Dr. Mayuri Kothiwala. She's a cosmetic gynecologist and laparoscopic surgeon, Skin Eva Clinic, Jaipur. And we are also happy to have with us Mr. Madhusudan HK, the president of Alma India. A warm welcome to all of you on our show. Thank you so much for being with us.
Thank you.
Thank you.
Sure.
All right, so let me start and talk about some of the myths that do exist about vaginal health. And Dr. Samundi, the first question coming out to you is, are women, supposed to smell like a flower garden, at least, down there? Why is it so imperative to focus on vaginal health for women?
No two women will have a similar vagina. The vagina, the length, the size, and how it looks, it's all, and the vulva, how it looks, it's all different. I mean, in UK, somebody has made a great wall of vagina with different kind of size and shape and all that. So the vaginal health is very, very important for women to kind of have a normal sexual life. That's very important. And vagina helps us to have normal menstruation also. Supposing vagina is obstructed by during when the child is born, if the vagina is obstructed due to some malformation, then the menstruation will not happen. So menstruation happening regularly shows that the vagina is functional and it is open. And it's very elastic, and it can easily enlarge during coitus and childbirth. And the pelvic floor exercises and the regular exercises can keep the vagina very very effective, and it will not become loose. And the women should do a self-examination of the vagina to see if there is any kind of polyps or any kind of swellings there, any kind of abnormal discharge and all that. So immediately they can go for a gynecological consultation. Vagina's pH varies between 3.5 to 4.5. It should be kept at that. And if any chemicals or any other douching method or any scented products, if they're used, it can alter the pH of the vagina, which will invite bad bacteria into the vagina and causing infections and bad odor. So the bacillus, the lactobacilli, which is present in the vagina, or good bacteria, and the vaginal epithelium gets kind of renewed every 3 days actually, and because of that there will be some discharge also. It will be a healthy discharge, and that acts as a lubricant during the sexual practices. And and also um, there are some methods of keeping the vaginal health will be by using some natural methods like using aloe vera, and previously they were using curd and all to keep the good bacteria inside the vagina, and baking soda and salt water, all this can help the vagina to drive away the infections. But in US, actually about 57% of the women use cleaning of the, I mean, they clean the vagina regularly. But in our country, the poor hygienic practices, the vaginal health is not kept at a good condition, and there may be infections which is associated with that, and leading to poor sexual health.
Right. Dr. Purva and Dr. Mayuri, would you like to add something here? Do you need to clean a vagina? Does it clean itself?
And Dr. Samandi has done justice to this question, and she has very clearly explained everything. I don't think there is much more needed to add to this answer.
Great. Dr. Purva, do you want to add anything?
No, I think we're good. We have we will be covering a lot of other aspects of this discussion as well. So I think we will take it to the next level.
Right. So, Dr. Purva, I want to check with you, how safe are these intimate hygiene products for maintaining our vaginal health?
Honestly, Anisha, as Dr. Shamandi has rightly mentioned, all these intimate hygiene products have probably come into Indian market that way, more so in the last decade. And, you know, more and more urban women and now even rural women are kind of starting to use these. But we need to understand, you know, why we should kind of even get into it. Because in some aspects there is a role, and, you know, in other aspects there is definitely no role. You asked in your last thinking that, you know, why vagina is so important, because that is another cavity in our system for women, which is directly connected, you know, internally to a lot of organs. So if women do have any sort of vaginal infections, it can be transmitted into the uterus and into the fallopian tube, and can, you know, eventually lead to a lot of not only fertility related issues, but also in their regular lifestyle, having, you know, severe pain during their menstrual cycle, and, you know, pain during having intercourse, and that can kind of hamper them in having a regular lifestyle. And that's the reason why it is so important to maintain vaginal hygiene. And that is probably where the entire market of vaginal hygiene products has come in. But honestly, in case if we are able to use regular simple water is more than enough for us to wash the vaginal region. We don't need, you know, an intimate water, which is actually acidic in nature. If you do not have any infection, or if you're not probably having your menstrual cycle, and if you go ahead and repeatedly keep using, I get patients who say that, you know, doc, I keep using, you know, an intimate water 3 times in a day, morning, afternoon, and night, and still I have vaginal discharge, and, you know, I still have foul smelling discharge. I don't know what, and they kind of equate it to an infection, which is not. And in fact, using the vaginal wash is what is causing them this problem of, you know, dryness and itching and, you know, other sort of irritants. So no, I think there is a very, very limited role of intimate hygiene products which is there, and they should definitely not be overused.
Right, but Dr. Purva, if there's no need to overuse intimate hygiene products, but what about the good old regular soap that you use to bathe, or the shower gel? Are they as safe?
So in fact, that is the reason I think why the intimate washes have come in picture, because the pH of the soaps that we normally have is much more acidic, and it can cause much more damage. And it's not very sensitive. It is more harsh. Just like why we prefer using face washes, and we've moved on from using regular soaps over the face. If you're not using it over the face, why would you really use it over your vaginal region? So no, it's stuff like Dettol or any antiseptics and any regular soaps that you're kind of using for your body, I don't think should be used for vaginal region at all, because that is going to cause you much more harm per se. So if at all you do feel like using your a vaginal wash, then it has to be an intimate wash and not your regular body soap.
As Dr. Apurva said, no soap should be used for cleaning the vagina, and simple water should be enough to wash it. And previously they used to put this steam and all that, steam and hot water and all that. That should not be practiced actually. I've seen in Konark, and that is in Bhubaneswar, I saw a sculpture where a woman had delivered and she has a baby in her hand, and she stands with her legs stretched apart, and there is a fire from below. So in those days itself, they were practicing these hygienic practices to kind of, especially
extreme measures.
Vaginal health gets affected post-abortal and post-delivery usually. In our women, they do not use hygienic pads and all that, so they get into infection. So post-abortal and post-delivery, these vaginal infections can creep in.
Right. Dr. Mayuri, Dr. Samandi also talked about, how the lack of hygiene then leads to diseases, and then because of diseases, your everyday life gets impacted. Your intimacy, your confidence, everything. Now, there are also some myths about, vagina and aging. How aging impacts vaginal health. What are these big myths?
Yeah, sure, ma'am. We all know that there are many myths surrounding the vaginal health in our society. So I would like to highlight a few of them. First one, which is most common and which ma'am has done justice to answer both of Dr. Samundi and Dr. Apurva. They have clearly said the first myth is that it is necessary to use specialized cleansing products for vaginal health, for maintaining vaginal health. But the fact is that vagina is a self-cleaning, it has its own self-cleansing properties because it contains a healthy bacteria, lactobacilli, with the help of which it cleanses itself every 24 hours, and it is presented as a small amount of normal vaginal discharge. So it is better to avoid all these scented, perfumed products, soaps, and if douches. Most of the women, they believe that if they will wash their vagina with a large amount of water, then it will clear it off. But it's not like that. It's better to use plain lukewarm water to clean the vagina, or use unscented soaps or products. And the second common myth which women present with, it's like it is normal to have some amount of pain during intercourse. With aging also, they feel that after menopause or after pregnancy, mostly they come to us and they say that they experience small amount of pain, and they say it is normal. But the fact is that pain during intercourse is never considered to be as normal. And ever if you have dyspareunia, that is pain during intercourse, then it should be reported to the gynecologist as soon as possible, because it is generally related with some or other pathology. Another common myth which prevails is like vaginal discharge always means that there is something wrong down there. But it is not like that. As I said, vagina is a self-cleansing organ, so it cleanses itself, and some amount of discharge is absolutely normal to present. And only if the discharge is associated with with any foul smell or abnormal presentation, or it is associated with redness or itching in the private parts, then only it requires in further investigation. Another myth is that you can treat your yeast infections or vaginal infections with home remedies like yogurt, garlic, ginger, etc. But you should not play with your private parts. Vagina is a delicate organ, and any infection, either be it yeast infection or any other bacterial vaginosis, etc., it has to be treated with proper course of antibiotic or antifungal. And home remedies will not, they will never cure the infection. So they have to means you should identify the symptoms which indicate that you are having vaginal infection, and you should not neglect those,
Mhm.
because
Yeah,
complete
Dr.
cure will only be offered with antibiotics or antifungals.
Right. Dr. Mayuri, you said, there are some patients who come to you and say that, I'm having pain during intercourse. Is there a particular age group that has more of these complaints?
Please pardon.
Yeah, but normally, although sex may not be as taboo as it is used to be, the idea of sex as one gets older is still clouded with myths and uncertainty. Older women do not need sex or want sex anymore. That is one of the myths. If you look at the sexual health, and elder people are not able to handle sex even if they desire to. And elderly women are too fragile and weak, so they can hurt themselves when they have sex. And older people are not physically attractive and thus not desirable. And douching is a good way to clean the vagina. And climax is not possible in older age women. These are the myths associated with that sexual health. Actually, today I was talking to one of the consultants from US. He was telling that women at the age of 80 also come for sexual health guidance actually for them.
Mhm.
And they get married also at the age of 80. But many people come at the age of 80, even more than that, for sexual health consultation actually. And so in our country, after the age of 45 or 50, I think the sexual life is closed for them actually. That is what our elders used to say. They look after their children, they look after their family. So it's a different culture altogether in our country. But still nowadays, it's kind of, as Mayuri rightly said, it's people get a lot of exposure to other news and all that. So it should improve. Actually.
So, Dr. Mayuri, one question to you then, is there any truth to this that, with aging, intercourse becomes painful? Those who complain
Yes.
about pain during intercourse, are they from this subset of people who are generally older?
What is seen after menopause in menopausal ladies, that is an average age of menopause in India is 51 years of age. So perimenopausal age group, that is plus minus 3 to 5 years from that age group, the estrogen level, the hormone that is essential for maintaining our menstrual cycle, it reduces dramatically, it falls dramatically. And estrogen is one of the most important hormone for maintaining the vaginal health. So when the hormone levels fall, it leads to vaginal dryness in older women, in women nearing their menopause. There is this they feel their vagina is dry, so there is lack of lubrication. When the vagina is dry, the wetness reduces, and when they attempt intercourse, it is quite painful. So because there is lack of estrogen, lack of vaginal moisture, vaginal dryness, it leads ultimately to vaginal atrophy, means the vaginal normal healthy mucosa, it gets atrophied, it gets thinner and shrunken. So if it is not corrected, if we do not treat it on time, then it might lead to another symptoms that I will be discussing in further in this lecture, that is that it might lead to genitourinary syndrome of menopause, where there are where other symptoms of menopause come into play, and there is urinary problems also. So it's not like that's what I said. Any time at any age, pain during intercourse should not be considered as normal. It is never normal. It always indicates some or the other pathology,
and that should be investigated.
Yeah.
Right. Mr. Madhusudan, Dr. Samandi said, our cultural upbringing is such that, after a particular age, interest in, sexual life for women should go down or generally goes down. But, women are suffering in silence about vaginal health issues. And, they see that the quality of life reduces, the confidence, the overall well-being is also lower. Do you think that, because of these myths pertaining to feminine issues, this is the reason behind this silent suffering?
Yes, I think I'll slightly give a perspective in terms of what's happening around, and then I'll also bring in little statistics to drive the perspective. So during the discussion, we heard that actually we have now intimate hygiene in the products which are available only for the last 5-6 years. Plus, I think if you look at the consultation, that really the doctors, or rather actually the patients, come for are just now being seen, in the clinics, which meaning to say that the number of conversation that happens at the clinic, outside the clinics, at the industry level are too very less. Forget about actually myths, even actually to create the awareness. To me, first is the actual awareness, then actually you keep talking about it, then actually there are certain myths that gets busted. When I talked about the statistics, I'll give you some statistics now. We talked about menopause, and we talked about urogenital atrophy, we talked about vaginal health. North American actually menopause society talks about what kind of population would we have by 2025. They estimate close to 1.1 billion women would be in the stage of post menopausal stage. And if you just translate that into Indian population, India population contributes almost 17% of the overall world population. I'm just for the discussion sake putting that percentage into India. By 2025 we will have close to 25 million plus women beyond or actually in the post-menopause area stage, meaning to say that actually the urogenital atrophy, which is the most common problem that the menopausal women would go through, would be that very high. Plus also the painful intercourse and dryness in the vagina, which are some of the issues that the experts spoke about. You will see that the percentage of these issues in impacting women would be closer to 20 to 40%. So you can imagine actually the magnitude of the issue that might be up by 2025, and therefore actually it's extremely important that actually this myths or to me it's more about awareness. So therefore I would slightly change it and then say looking at the magnitude, looking at actually what we are going to have in hand just in a couple of years around. I think it's important that this gets addressed, and I completely agree that it's about busting the myths that actually pave the way for all this handling of these issues.
Right, and that is why we have gathered all of you together, so we can bust some of these myths. Dr. Samandi, why is there this lack of awareness? In fact, in urban women, do you think that there is a lack of awareness? Dr. Mayuri said that her patients feel it's okay to have some pain during intercourse. Why is there, lack of awareness, and what is the reason behind it?
In our country, the awareness about sexual health is very much less actually. It's high time that women embrace their bodies, their needs and dysfunctionalities. Sexuality being a part of women's life needs attention, and sexual health topics need to be advanced. But things are changing, at least in urban sector, because of education and awareness. And women are acknowledging that they need sexual satisfaction and fulfillment of their sexual desire. Many relationship issues and psychological problems start setting in if sexual health problems are not dealt with. Problems like vaginismus, anorgasmia, and lead to drifting away of the partner. This is we have practically seen in many couples. This kind of disharmony, marital disharmony can happen, and it's necessary for women to be open about sexual health and reach put if there are any problems for timely intervention and for healthy and happy life. There are in our infertility practice, we have seen many couples in whom the marriage is not consummated at all for so many years, 5 years, 6 years. Even they will be living in the same house, but there would not be any relationship between the husband and the wife. So nowadays, because of the work pressure and because they want to postpone their pregnancy, because they want to kind of attend to their career first, this can happen. But normal relationship is lacking in them. Only when they want to have a child, they think about the sexual life, actually. So this kind of problem is happening day in and out. And we have seen so many cases of vaginismus, actually. Whenever the husband wants to have sex with the wife will run away with the pain, and she will not allow. That vaginismus is more common these days. And also, but that can be due to kind of pain in the vulva when they start having sexual life. But all this can be addressed by consultants, and it can be cured, actually. With laser treatment of the vulva, many of our patients with vaginismus have responded very well, and they are very cooperative to the sexual life.
Right. Ma'am, Dr. Samadhi, what is vaginismus?
Vaginismus is whenever there is a intent of sexual intercourse, the woman kind of doesn't allow. They will have very much pain in the vulva and the vagina. So they don't allow the intercourse.
Right. And is a medical treatment required for this?
Yes, of course. Counseling is very important before that. And laser treatment, recently we have done a few cases of vaginismus with laser, and they have responded very well.
All right.
Anisha, if I may take on that, I think
yes, please.
You should be very happy that you don't know about vaginismus that way. So it's actually a good thing. So vaginismus technically is an involuntary, inability of the women to kind of have a normal sexual life. So just at the idea of a penetration, or even it does not have to be even a penetration per se. Even if we kind of take a finger or even an ultrasound probe to the vaginal space, they have this psychological fear of anticipation of pain that they involuntarily contract their inner thigh muscles, so that it's almost impossible for anyone to enter the vaginal space. And it's because of this fear and psychological aspect of it, that even after 2 years or 3 years of marriage, they might not consummate the marriage also. So even when they come to us for treatment, they are coming saying that, okay, we are not able to have penetrative sex. The husband and wife still love each other as much, and they're still not able to have penetrative sex, and they probably want assisted fertility treatments in order to just have a baby. And the awareness about this also is kind of really growing up in everywhere.
So, Dr. Purva, do you treat the fear, the psychology of it, or do you treat? I mean, what is there a physiological reason as well?
So So the physiological part of it is going to be very, very, so as doctors or as gynecologists, that is where we step in and understand if at all there is any medical condition or it is just the anxiety and the fear. So obviously we will have to, it's not like I give them a pill or, I go ahead and, give them an injection or a shot and, they're going to get miraculously cured. For some, it might take, just a verbal discussion or, reassuring them, letting them know that nothing is wrong and, probably giving them encouragement itself works. And for others, as rightly said by Dr. Shamundi, we might have to be a little more intervening and consider doing a laser in order to improve the possibility of having a normal sexual life for them.
Right. Dr. Purva, Dr. Samundi also said that you should do a vaginal self-exam to look for polyps, etc. Now, how do women know what a healthy vagina is like, and how can they do a self-exam?
That's actually the problem, because a lot of times we get young girls who kind of come in and say that, okay, doctor, I have a big lump or a big mass that is there in my vaginal region. I need you to have a look at it. And we see, and it is probably just the normal anatomy. They probably have a slightly large labia majora, or they slightly have higher fat in their mons pubis region, which is absolutely normal. I personally think that it is technically a little difficult for you to do a vaginal examination. You could probably, Indian women are probably more comfortable still doing a vulval examination, but placing fingers into your vaginal region and, really be able to figure out what is the normal anatomy of it and, understand if there is anything abnormal about it and come to a doctor. Unlike a breast examination, which is something that is really visible for you and, something that is easily palpable. It becomes very easier. But I think self-vaginal examination is difficult. If you're, unless you are using a menstrual cup or a tampon and, you are already inserting your fingers inside. So you have a sense of it and you would know how the discharge is in case if there is any change in consistency, or if you suddenly feel that a menstrual cup which you were able to easily insert before without any pain has now started becoming more and more painful. So these are the practical situations probably wherein you would make a note. But most times it's probably the partner, who identifies or notices any change in the vaginal or vulval region, because they are probably more observant towards it as compared to the women themselves.
All right. Dr. Mayuri, Dr. Apurva has given us some, cases where people have come imagining something wrong with their vaginas. There was nothing wrong, but what are the indications that call for a consultation for vaginal health?
Yeah, before answering to my question, I would like to add that if women just pay attention on the amount of discharge, if the discharge is foul smelling or not, if there is any foul smell from their discharge, or if there is some bleeding, unusual bleeding from the vagina, or there is pain as discussed before during intercourse. So these can be some symptoms. If we encourage women to know about what the normal symptoms of a normal healthy vagina are, like what are the symptoms of a normal healthy discharge, so they can easily differentiate what is an abnormal discharge from normal. Most of the things, most of their answers the questions will automatically answered just by examining from their discharge. Abnormal discharge from the things, most of their answers will automatically.
Sorry, please go on.
My voice is echoing.
Sana, please go on. Sorry.
So I just want to say that we should emphasize on their not on vaginal, how to do self-vaginal examination, but to how to examine their discharge. And if there is any symptom, local symptom like itching or redness in their private parts, that would be sufficient if they know about these symptoms and they immediately report to their doctor. Other than these, I would like to emphasize that there are some indications for which you should consult your gynecologist. Like if you have bleeding in between your periods, bleeding during menses is a regular bleeding during menses is a normal sign, but bleeding in between periods is something indicative of some pathology inside. Or there can be bleeding after intercourse. There can be urinary complaints, burning during urination, or there can be increased frequency of urination. These are the signs and symptoms of infection, local infection. As I previously said, there can be itching or burning or foul smell in the discharge associated with vaginal discharge, or there can be pain during intercourse. Any of these symptoms, if they experience, they should immediately report to the doctor, because delaying in the treatment will worsen the situation. It will not help anyhow.
All right. So now we know when are the reasons you should head to the doctor. Mr. Madhusudan, how do you see Alma contributing towards helping women in India overcome some of these myths about vaginal health?
So we heard, through the expert that actually it's very what we think, is simple, like actually keeping the area clean, or about the discharge, or what actually a healthy vagina looks like. These, we think are simple, but yet, we see that actually there is no awareness, or there is myths around. So what we are planning to do, and then we have been doing, is to work at the grassroots level, and therefore actually we are trying to work with multiple systems around. We are working with organizations like gynecology organization, both at the national level and also at the regional level, conducting various programs directly to the consumers. We have tied up with the hospitals, and then we have been doing programs, conducting the programs to the consumers directly. We did have national programs on the television channels involving the experts to talk about what actually an intimate health would be, and then how actually women should take care of their overall women health. And of course, we have been employing across all media channels, including the social media, to reach out to the patients and women at large, in terms of trying to help them understand actually what would women wellness means, because it is not just about face. So we are trying to see that actually if you're talking about women wellness, it has to be holistic and it is overall. So we are basically trying to say, I'm saying here is, we are working at the multiple levels, and then trying to work at the grassroots level to build the awareness with the doctors, organizations, with hospitals, and so on and so forth.
All right. So the awareness is definitely important. Dr. Samandi, in your previous comment, you said that because of the lack of hygiene in India, we see a lot of women have, some diseases, and it affects their lives. While you cited the example of the US, where 57% of women are using douches to keep themselves clean, is that really required? Is that what would be suggested to Indian women as well? What are the natural ways to keep your vagina healthy, and how much intervention is required on our part itself?
Actually, the douching is not recommended actually. If douching is done vigorously, many times it can itself invite infections actually. And to keep the vagina healthy, you should not use any soap or any scented material, but a simple wash with warm water should be enough. And if there is any bad odor from the discharge from the vagina, then you should consult a doctor, a gynecologist, to get this one treatment. And there are older natural ways of doing it, is by using aloe vera dipped in water, that can be used, and curds can be used, soda water can be used. All that is there in the literature, but they are not practiced regularly. But between normal vaginal health and abdominal vaginal health, mainly the odor is the problem. If there is any smell or any itchy discharge or any curd-like discharge, then they have to consult a doctor and get treated.
Right. Dr. Samanthi, what you're saying is that washing with plain water and things like that, these are very simple things to do. Then in your practice, why do you see so many cases of diseases? Because hygiene is not practiced. It doesn't sound very difficult.
The hygiene, mainly the menstrual hygiene should be good actually. When they use tampons, they get that septic shock and all that. So in our country, not much of tampons are being used. But when they use the sanitary napkins, it should be kind of sterile actually. It should be clean.
So are you saying that because we in our country so far, sanitary napkins are also hard to come by, and women are using fabric which is not clean properly, that is the reason why they have?
Yeah, in those conditions, definitely the infections can creep in and they have a poor vaginal health.
All right. Dr. Apoor, apart from the natural ways, what are the non-surgical ways to keep your vagina healthy?
Doctor, your audio is on mute.
Yeah.
Sorry, okay, I'm going to repeat that. So I was saying that adding to what Dr. Shamundi has already said, totally agreed that, menstrual hygiene is very, very important for us to maintain good vaginal hygiene as well. But if you notice, we have a lot of modern women or urban women who are coming up with vaginal discharge or infections. Now that can to a certain extent be with respect to the kind of change in our clothing as well. Indian women are honestly being used to wearing saris for so long, and most of our grandparents or probably them weren't in the habit of using regular innerwear, because we are typically a hot and humid place which has a higher chances of having sweat accumulation in your groin region, which will increase your chances of having infections. And that is the reason why we kind of dress how we dress. But now we have more women who are wearing Western clothes, or they wear tight jeans, or you have your leggings, and you have a lot of clothes which do not really have a lot of aeration. And unfortunately, in case if your weight is also on the higher side, it means that you have more and more sweat that is accumulating in that region, which is the reason why, despite how many times you are going to use a vaginal wash or a soap and you are going to clean that region, if it is going to have an accumulated sweat, it has a very high chances of developing infections. So that probably is more common and more common reason for vaginal infections than anything else in our current urban women. Apart from, of course, your sexual habits and your diet, anything that you eating too much in sugary proportions, your soda, and in case if you have alcohol, all of this is going to alter your vaginal environment, which is going to make you more prone to developing infections.
As Apurva said, nowadays girls, even from the teenage, they start wearing tight clothes like the jeans.
No, nothing, absolutely nothing against the kind of dressing. Obviously I wear them myself. Absolutely nothing against
that prevents the aeration, and
that's it. It's just a reason why you might be having higher chances of developing infections. So coming to the non-surgical aspects of improving your vaginal health. So ultimately, as even Dr. Mayuri has mentioned before, as you age, the vascularity to that vaginal region sometimes gets reduced. And anything that is used to stimulate, a region to kind of make it more youthful, targets at improving the blood supply. And that's pretty much how any technology works, and that's how even laser would work, by improving the vascularity to the region, and thus helping you fight with the infections also, and improving your immunity levels as well.
Right. Dr. Samandhi, you wanted to add something?
I think she has told elaborately.
All right. Dr. Mayuri, Dr. Purva has mentioned a few things that can be treated with the laser. What are the gynecological indications that can be treated using a CO2 laser treatment? Because we've discussed urinary incontinence and things like that. What are the other gynecological indications that can be treated using the laser?
Yes, ma'am. Dr. Apurva has rightly said, laser is a new modality which is coming up nowadays. And I would like to add on that CO2 is very fast, it is safe, it is cost effective, and it has no downtime. And women undergoing this CO2 laser procedures, they can resume their routine activities immediately after the procedure. And in fact, uh, what we recommend is that there is only 3 days abstinence which is required after the procedure, if at all, and there is no long downtime which is required in other procedures like in surgery or any other thing you undergo. So it is being widely accepted nowadays amongst the doctors and the undergoing treatment, undergoing the women. So the first indication I would like to stress upon is the stress urinary incontinence, where there is involuntary leakage of urine amongst the women, associated with increased abdominal pressure. Like whenever you cough or sneeze or increase heavy weight, put on heavy weight, or you do anything, you do heavy exercises which increases your intra-abdominal pressure, so it leads to leakage of urine. So it is a it becomes a social issue for women, because they many a times leak urine whenever they are sitting in a public
Right.
So laser is a very good treatment option for these women. And 3 sessions of CO2 laser, CO2 femilift laser has shown wonderful effects in such women. So first is the stress urinary incontinence, which we have already talked about. Other indications can be like vaginal dryness. In postmenopausal women, as we discussed, vaginal dryness has good results, and recurring vaginal infections in women who present with infections more than thrice a year. They are called recurrent vaginal infections. In those also, because laser, what it does tissue remodeling, which makes the vaginal tissue healthy and resistant to infections. Like Dr. Apurva said, it increases the immunity sort of. It can also be introduced in post delivery cases, where it uh, improves, and it has a better recovery rate, and it improves the speed of recovery. So it is called like post delivery rehabilitation programs also, many of people are offering nowadays. Similarly, in postmenopausal women, like I talked before, due to reduced estrogen levels, so there is atrophy of the vaginal mucosa, which leads to painful intercourse and dryness and other symptoms. So these can be combated with CO2 femileft laser. Other than these, you can use CO2 femileft laser for maintaining your general vaginal health, and also for vaginal tightening, for improving your intimate relationship with the partner. Other than these, CO2 laser as per se can be used for removal of genital warts, and tags, skin tags, and anything else, like surgical, for it can be also be used for surgical methods.
Right. Dr.
There are
Samandhi?
other conditions also, like
Yeah.
vulvodynia, where again there is pain in the vulva region. It can be after an intercourse, or just simply there is pain in the vulvar region due to the nerve end getting stimulated. So for that also, the Femilift, as our Mayuri said, it's very good actually. And it can be used in condition called lichen sclerosis, where there is thickening of the vulva. There are thick lesions over the vulva, and that can be treated with the laser actually. And of course, she talked about vaginal rejuvenation for vaginal laxity and looseness after delivery. And in fact, many of the centers offer it as a kind of a value-added service after delivery. one shot of this laser treatment. And
Right.
for cancer survivors also, it's very useful actually, this
Right. Dr. Samandeep, Dr. Mayuri said that the only thing she tells the patients is to maintain abstinence for 3 days. Now, we want to understand for patients who want to consider this laser therapy, how much time is taken? What are the number of sessions required? You said that, one shot is given for some of these birthing centers who may have this plan. But if I am not taking that, if I have to go to a doctor and start from the beginning, how much sessions are required? How much time does it take? Could you give us details there as well?
Actually, they call it as a coffee break procedure actually. You can just come in during the coffee break and have it done and go away. It takes about 10 minutes to 20. I mean, it is for the preparation and this one, but the procedure time is only about 5 to 10 minutes. So it's a coffee break procedure, and as she rightly said, there is no downtime. You need not take any bed rest or anything. There is no surgical procedure. And for vaginal tightening, that is vaginal rejuvenation, post-delivery, one session should be enough actually. If it is not, very effective, then they can undergo another session. But for SUI and all that, we recommend at least 3 sessions actually, 1 month apart. In 3 months,
Right.
they should be able to do this one. And also for first degree prolapse of the uterus also, we have done for many cases, and they have responded very well.
Right. Mr. Madhusudan, what is Alma's vision in bringing FemiLift to India? You gave us the data and the statistics. Going ahead, we could be having a lot of cases where women need this service. How do you see this impacting the quality of life of women?
Okay, so just a few seconds, on Alma. So Alma, is a global leader, in energy-based, solutions. We are present in over 90 countries across, and the vision of Alma has been, and then is that it's we talk about the quality of life, not about treating in a condition, and therefore actually if you look at the systems that are available with Alma, and then what we sell is we have more than 50 platforms treating in more than 100 conditions from head to toe. So we talk about actually overall quality of life, and then when we talk about specific to the laser machine, which now we have been talking about FemiLift deals with plethora of indications. So it's a simple minimally invasive procedure that happens as somebody man said, it happens in just a coffee break stuff. So what we are looking at is trying to look at the women wellness as a whole, and therefore not just at one in indication or one condition. So when someone looks at Alma, Alma is a service provider, a solution provider for something that involves the entire body from head to toe. And we are looking at working into various organizations, and we are looking at various levels, and then trying to see that how this can be reached out to as many patients as possible, because for us we see that actually the challenges and lies at a 2 level. One, talking about the condition itself, like the experts sitting here spoke about all those conditions, but when we really get into the actual conversations that happens at the clinic are still lesser. So what's important is to make and talk that these conditions exist. Like Dr. Mayuri said, painful intercourse is not normal. One should not treat that actually it's okay to have pain during intercourse. So as simple as that, that's about educating there is a condition, and the other thing is about there is a treatment that's available. Just go to the doctor, talk to them, and then they are able to help you out. So Alma is looking at actually these 2 levels of challenges to address, and we are onto it.
Right. Dr. Purva, what are the precautions required, and are there any side effects of this laser treatment?
So we'll first talk about the precautions that way. I think the only thing that we need to kind of ensure is certain pre-treatment and certain post-treatment. So before you actually get the treatment, we just need to ensure that you're not having any active vaginal or urinary tract infections. And you shouldn't be having a menstrual cycle so that the efficacy of the treatment is at its maximum. Post procedure, because this is at the end of the day a heat based procedure, we need to ensure that anything which is warm or too hot shouldn't kind of be exposed to the vaginal space for the next 3-4 days. So no sauna or no hot water showers or hot tubs, these kind of activities which can increase the vaginal temperature should be avoided. And likewise, we ask to avoid intercourse as well, at least for the first 3 to 5 days, so that they're not sore and they don't have any spotting in order to prevent these issues. And thirdly, we also kind of ask them to avoid swimming, because sometimes there can be some amount of water entry back, and there is a little bit of raw area that is present in the mucosal region. So in order to avoid any infections, we ask them to refrain from swimming kind of activities in the first 3 days. Anything essentially to increase the temperature. So this is with respect to any sort of short-term side effects which we kind of asked you to avoid. Beyond that, I don't think there is any other impact. You can have as many sessions as you want, as long as you're maintaining the gap between each of your sessions per se.
All right. And Dr. Mayuri, what are the risk factors of ignoring your vaginal health?
The risk factors, as I already said, ma'am, most of these vaginal conditions, they are very easy to treat if we entertain them very at the beginning stage. But if you neglect your health, you neglect your vaginal health, and you take them to a higher level, then the things will become complicated and more difficult to be treated. So for example, if I say, if you neglect or avoid going to the doctor, neglect your complaints of vaginal discharge, simple vaginal discharge can lead to pelvic inflammatory disease, that is the inflammation of the upper genitalia, like the uterus, fallopian tubes, and the other pelvic organs. They also may be involved due to the vaginal infection. And other than this, abnormal bleeding, any abnormal vaginal bleeding or foul smelling discharge might be a sign of malignancy, and if we neglect that, the disease may progress. Other than this, there might be if during pregnancy you have vaginal infections and you avoid them, it might lead to preterm labor pains and low birth weight babies. Similarly, in postmenopausal women, like I said before, it might lead to genitourinary syndrome of menopause, where if you keep on neglecting the symptoms, dryness and all, so it might be become a complex disorder of GSM. So it's better to immediately report to your gynecologist rather than making things complicated.
Right. Mr. Madhusudan, what has been the impact of the corona pandemic on women, seeking treatment for vaginal health?
I think, the pandemic, overall has impacted across, the therapy area. So therefore, I think, it did impact the gynecological conditions, and including the vaginal health as well. But, for us, I think it's a little, beyond, corona, because we all together, we will, come out of this, pandemic, very soon. What we are looking at is a little, longish, and then during this, the way, we utilize, the pandemic, was trying to see how much and then how far can we reach out, to this, by conducting, numerous, programs, at the doctor level. We did multiple, webinars, involving, various experts. Some of these experts, who are present here, were also there, part of the programs in which we conducted. We had international, local, webinars, and then we conducted, various consumer, programs, as well. And I'm very happy to share that, we have been reaching out to, a few lakhs, of consumers through various programs, including this one on the platform of, Break the Silence. So that's been something actually, for us, the pandemic, being.
Right. So pandemic has not been a reason for us to stop talking about this, because the awareness is important, and it's we want to tell all the women watching that you don't have to suffer silently. If you have problems, there are solutions which are painless, time effective, and that can be done. You just need to speak to your doctor and figure out what would be the best treatment for you. I would like to thank all of you for taking the time for joining us today. Dr. Samundi, Dr. Mayuri, Dr. Purva, Mr. Madhusudan, thank you so much for being with us in this show today to create awareness about vaginal health and how these myths need to be dispelled, and how you can take these issues into your hands and make the decision that will be the best for you. Now, if you have been watching this show and if you have any more questions, you can send them to us through WhatsApp. We have completely run out of time, and today we will not be able to take up questions, but do keep sending your questions to us. You can click on the WhatsApp button on our page and send us your questions. Don't forget to follow us and stay updated on all the concerns about your health and well-being. We keep giving you a lot of updates. This program was supported by Alma Femilift. Do follow us on Facebook to get all the updates about our upcoming programs, and keep sending us your questions. We will try to improve them in our next show. Till then, stay at home and take care. Goodbye and have a good weekend.